Well, good afternoon. The executive order that we signed on Monday went into effect today. One thing that we communicated on Monday, as we receive additional information feedback, if need be, we would make some modifications. And so moments ago, I signed a new order allowing us to make that needed modification. I want to take time and communicate the things that have transpired since we met together on Monday. I've been in constant contact with the mayors of West Texas and Wichita Falls. You may know the two confirmed cases in Lubbock on yesterday. It is important to note that both of those cases were travel-related, not community-related, as well as the one in Wichita Falls that was confirmed on this morning, being travel-related and not community-related. Mr. Hanna and I met this morning with the staff, the medical staff at Henry Medical Center, and Dr. Lowry will come up and speak in just a bit after Mr. Hanna and provide more detail. What we decided to do is really lean on them like we've been doing, allow them to provide some feedback. Additionally, Mr. Hanna and I joined in on a phone call with Vice President Pence, as well as other mayors across the country. They also gave directives. I've also been in conversation with Jody Arrington on today, and the congressman wants us to know that an order that I signed, by the way, reduces, it goes from 250 to 50. So from 250 to 50. Wichita Falls, Midland, Odessa, and Lubbock are all at 50 now, or will be at 50 within the next 24 hours. So Congressman Arrington acknowledges that that cap on groups will have an impact and will adversely affect a certain segment of our community. His counsel, and we concur, is that it does create hardship, significant for some in the short term, but if we can get past this, it'll eliminate, and Dr. Lara will speak to this a bit also, things we have to do in the future. It will curtail it, and so that's some of the rationale behind that. Doug Peters is working with Calvin Davis. Calvin Davis oversees the SBA for this region with an opportunity to help the business sector. Spoke to a couple of retailers on yesterday, and they've already seen a reduction in revenue of around 20%. And we anticipate that being exaggerated. And so there are some mechanisms that are in place that may have an opportunity to assist in the interim some of those businesses. One thing that we have talked about is we want to communicate to this city that we are prepared. There has not been a day where we've not been engaged having conversation about the things that we ought to be doing. We are prepared. We don't want to cause panic, but we do want to be responsive. And we want to be sure we do everything within our power that we don't promote the spread of this virus. Again, there are no confirmed cases in Abilene, Texas. We have 2 in Lubbock and 1 in Wichita Falls. Save those, there's not any confirmed cases. I think our medical care professionals anticipate we will have a positive case in our community. And when we do so, we're going to react. Embedded in the declaration, when we do have our first case, we will go to 10. We're going to follow what's been communicated to us through our president and through our governor and through our professionals here in our community. This is something brand new for us. There's not any kind of handbook that we can turn to look and see what we ought and need to be doing. But what we can do is do the best we can as long as we can. And I have faith not only in those men and women that are part of this process, As a Christian, I have faith in God. And I believe that we may have additional obstacles and issues we have to deal with, but as a community, I believe that we are going to be okay. When needed, we will provide additional information. I can't, Brad, your staff, as well as Abilene Regional, I can't thank you enough for your wise counsel. And Blair, please mention the congressman. I appreciate his mentorship. I appreciate each one of you being patient. Mr. Robert Hanna will come before you and communicate some things you ought to know about city services and how that may affect you, followed by Mr. Dr. Lowry, who will talk about some things that we want you to know also from the medical part. Mr. Hanna?
Thank you, everybody. Good afternoon. It's been a long few weeks. I want to reiterate what the mayor has said, is that effective 8 p.m. on Sunday, gatherings will be 50 or more will be a violation of the mayor's order. I know that impacts people's lives in a very real way, but what we were trying to do is to, as we've said before in the past, flatten the curve. In order to do that, we have to stay in front of this level of infection. And one of the things Vice President Pence said this morning, or this afternoon in the conference call, was that it's important that we are well in advance of this virus being present in our community. We don't have a confirmed case. I think it's naive to think we don't have people potentially carrying COVID-19 now in the community, okay? We mentioned some of the testing requirements and some of the testing challenges, but the reality of it is, I think, based on what we're seeing in our public health department, and I think maybe what Hendrick is seeing, we're okay at this point in time. We are well advanced of the spike. So I'm using my hands because I'm not like Ross Pro. I don't have flip charts and markers. Okay, for y'all that might remember that. But the curve, it's an exponential increase. Okay, so we're here at the base of this increase. And if you stay in front of this through social distancing, you have the ability to avoid potentially this exponential spike. At the very least, you end up lowering that spike, and you make sure that the medical facilities are able to meet the needs for the critical care that they're going to have to provide to patients with higher risks. So again, 8 p.m. on Sunday, we'll limit gatherings to 50. The first positive test case that the Abilene Taylor County Health Department has, at 5 p.m. that day, we will reduce gathering sizes to 10 or less, which is going to have an even larger effect, and we recognize that. But again, it's trying to stay ahead of that curve. Some exemptions are in place. Grocery stores are one of them, okay? We don't need people piling into the grocery store and buying everything off the shelves. The supply chains, those are all going to continue to run. Water and sewer, that's all going to be operational. This is not a tornado event, so we don't need to act like we need to prepare for a tornado or a hurricane, because that's not what's going on here. Office space, residential buildings, all those will be exempt. For those that have multi-story office spaces, they will be exempt from that, as well as hospitals and medical facilities. So what is the city doing? Effective Monday, I want to give people an opportunity, and also my staff an opportunity, to implement some of these changes. Effective Monday, all public libraries are closed. The municipal court will be closed to the public effective 8 a.m. on Monday. Ticket payments can be made online at abilenetx.gov. There's also a drop box at City Hall on 5th Street. All ticket due dates will be deferred for 60 days at a minimum, depending on how long this lasts. Customer service, or some people call the water office, they will also be closed to the public starting 8 a.m. on Monday. Utility payments may be made online at abilenetx.gov or placed in the utility payment drop box. Requests for new utility service will be available online. We're standing that system up, and you should be able to start service online. The issuance of all special event permits and solicitation permits are temporarily suspended. And we won't be issuing any more solicitation permits or any more special event permits. And then we are discussing how best to do this next thing, but we anticipate closing City Hall to the public on Monday as well at 8 a.m. The details of that will be released prior to the end of the week. City Hall is a nexus for government services for many in our community, and we want to make sure that we maintain and provide those vital services. How best to do that is something that, frankly, we are still discussing. But my commitment is if you need to get something done at the city will be there to help you get that done. We're not closing shop and going away. We're simply trying to make sure that we curb the level of infections, and we're making sure that the workforce that serves the public is protected so that they can provide the essential services that we all depend upon. At this point in time, I'm going to change a little bit from the game plan that the mayor just announced and invite Superintendent Joey Light to come talk. You're next, buddy. Yeah. Unless you're going to go ahead? Well, my notes are wrong then. Dr. Lowry, come on up.
Thank you. So I imagine many of you guys are more educated on the coronavirus, COVID-19, much more so than you were probably a week ago, as is the rest of the United States. It's most likely that kids and asymptomatic patients are carrying it, and they have mild symptoms or maybe no symptoms at all. And so they travel around, interact with friends, family, and that's why you see an exponential growth in the number of cases across the world. It's spread like wildfire, you know, starting in China and then through Europe, and now it's made its way here, which we've expected. But I'll say that there's a number of things that have been taking place behind the scenes in the city, at the hospitals, at our hospitals. Hendrick, I know, has made many plans and already implemented many different things to try to mitigate this risk and slow the progression of the disease. It's a new virus, so none of us have immunity to it. And because of that, that's one thing that makes it so contagious and makes it spread the way it does. And until it goes through our communities and we develop immunity, then the best we can do is try to, a new term many of us have learned is flatten the curve. And I think we understand what that means. As far as the strategies being implemented at the hospital, all of those things are designed to make sure that we have adequate resources and capacity to try to be ahead of anticipated needs for our community. And again, like I said, those plans have been in the works for a long time, not advertised, but in the works for a long time and are being implemented actively. So I'll ask my fellow Abilenians to also be proactive and try to help flatten this curve. Things that have already been done, we've suspended schools. It's my opinion and several of my colleagues' opinion that we need to continue this suspension, most likely indefinitely, until we see how quickly or how this spreads in our community. Because as I said earlier, young kids, I believe, are probably the vector, the ones that are asymptomatic or mildly symptomatic. And when they interact, it spreads throughout the school kids, and they take it home. So that is a reason I'm encouraging that we continue to suspend the schools. We can all continue to social distance. I know my family's at home getting reacquainted, playing games that they haven't played together in a long time, and running out of movies to watch on the DVD. But social distancing also helps to slow this progression. Online services, as Mr. Hanna said, are available for a number of different things, not just city services, but there are other opportunities to utilize online services. And I would encourage our community to, as much as possible, use those and just try to minimize interactions that are unnecessary. Those are some of the things that our public can be doing. And then at home, or when you do go out and interact, we're going to have to go to the store to get supplies and necessary things that we need for our daily lives. But when you do, be mindful. You don't do what I did and walk up here and put your hands on the podium. A habit, but we're all developing new habits. You don't touch things unnecessarily. You wash your hands, and when you are out, don't touch your face. Simple things, simple measures that can make a very big difference to our community and to ourselves. If you have some mild symptoms, not sure but concerned, you're most likely safest and best off just to stay home. Treat yourself with the Tylenol, the ibuprofen, the over-the-counter medications. Again, mild cold, a lot of people, this tends to be like a mild cold. And we don't necessarily go to our physician's office or seek medical attention when we have mild disease. I would encourage you to consider the same. If you're having more symptoms, more severe symptoms, and feel the need that you need to be evaluated, call your physician's office first. Reach out to them and say, hey, I've got fever, I've got this, whatever your symptoms are, and let them remotely help guide you to the proper area or procedure that needs to take place to make sure that you are evaluated and taken care of. Again, our goal is to flatten the curve, and we can all work together to try to do this. We want to limit our social interactions and do our best to work together and try to be understanding in what's going on and some of the measures that are being taken. I'd encourage everybody on this issue. We need to think globally but act very locally. And I thank you for your time.
Good afternoon, everybody. It is great to see you here. I want to thank Dr. Lowry for his wisdom and guidance that he's shared with me for many years. Thank you, sir. We are currently faced with an unprecedented pandemic that requires us to make challenging but necessary decisions. Wylie ISD appreciates Abilene ISD, the City of Abilene, local medical, community, and school districts across the region as we have collaborated in dealing with this issue. In light of the guidance from President Trump, the CDC, local, state, and federal government, and local medical personnel as well, I have decided that Wylie ISD in Abilene, Texas, will extend the suspension of normal district operations indefinitely. This is an effort to support our nation's need to slow the spread of the novel coronavirus, or COVID-19. Our health officials report that cases are continuing to spread in the state. Suspending operations will allow us, in coordination with local health officials, to determine if the virus is contained and when it is safe for normal operations to resume. The safety of our students, parents, staff, and the greater community are of the utmost importance during this challenging time. We will continue to closely work with all these groups, and if we determine that it is time to return to school, it will be announced approximately a week prior to resuming normal operations. And the information will continue to be provided via our website and regular channels of communication. We understand that this action will have widespread impacts including hardships on our students, their families, our employees, and the broader community. We have weighed these impacts along with many others. The gravity of this moment is not lost on our Board of Trustees or the Wylie ISD administration. During school closure, during the COVID-19 pandemic, all Wylie ISD employees will continue to be paid, and they will have expected job functions as the district transitions to at-home learning. Employees can expect to hear from supervisors with details relating to specific expectations. Our grab-and-go meal service will continue to be available every day throughout this closure, and you can find details about our food service on our website, WylieBulldogs.org, under the Grab-and-Go Meal Service tab. As we continue to move throughout this event, we ask for your patience and your grace as we go through these challenging times. Questions can be directed to our campus email addresses that again have been set up for questions, and those are on our web page, WylieBulldogs.org. Thank you for your support and cooperation and patience as we navigate through these uncharted waters to ensure that all the members of Wylie ISD and the Abilene community stay safe and healthy. Together, we're going to get through this.
Good afternoon, everyone. Thank you, Joey. Thank you, everybody, for being here. This is 3 times in 6 days that we've gathered like this. I shudder to think that I might have spent a little bit more time with some of you, some of our media partners, than I have members of my own family of late, as we've been working strange hours due to this situation in our community. But it is fabulous that we have the resources and the community collaboration that we do in Abilene to stand up and do appropriate things and be proactive in a situation like this. I know beyond a shadow of a doubt that I can pick up the phone and call any one of these gentlemen on the front row, or Congressman Arrington's office, or Hendrick, or city councilman. Everybody is working together toward the same goal. I've told staff members repeatedly over the last few days, we are educators, and that's very important to us. It's near and dear to our hearts, but it is only of secondary importance to the role we play as an organization in this community and helping the entire community be proactive. We're going to take care of educating kids, we know that. But the very most important thing that we do is prepare and follow guidance as a community to make sure that we mitigate the negative impacts that this virus has in our home. So let me tell you about some great things that I saw today. We've had teachers in today in all of our core content areas. I want to assure everyone we've spread them all over the district in small group sizes, but they have been building online content. And even in this room all morning, we had our technology department packaging Chromebooks and checking them out to employees and preparing to start to deliver instruction in a different way. And I've been seeing on Facebook, I'm not a big Facebooker myself, but I've seen teachers reading to kids by video on Facebook. I have seen parents requesting advice on how to deliver instruction to their children at home. I have seen love poured out from the school to the home and vice versa throughout this entire time. And that's what I think we have to be mindful of, is that's why we do what we do. We got into the school business because we love kids, and while we're having to interact with them a little differently in this time, that's still our driving force. And so, again, I just am so excited to see while we're doing it differently, the impact that education is having on our community. So as we talked last Friday, obviously we were looking at one length of closure, and then we extended that even at the beginning of this week. And certainly Joey has already stolen my thunder here in that the Abilene Independent School District, we are going to close our doors to students and the public indefinitely during this time. I echo the sentiments that he made of it. In the event that we are able to reopen, we will do our very best to give parents and families time to plan, and we will try to announce that type of reopening at least a week in advance, or something approximately about a week. And so we've got to just think about doing things differently at this time. I think we're in a good place as a community, still ahead of that curve, as Mr. Hanna emphasized, as we're doing things like social distancing, working from home where possible, and not putting people in large groups. And so we don't do this lightly. It is a significant thing to say we're going to be closed indefinitely. But here again, I come back to the point of, while education is incredibly important, even more important than that is our role in this community to help our community combat the virus in Abilene. So we could return to school at some point. I am certainly hopeful of that. I know that staff is hopeful, parents are hopeful, but we know that everything we're hearing from the medical community, from governmental entities, is that when we're at this point in this process, we probably need to settle in and embrace the long haul. And so for those reasons, we need to accept the fact, and we've begun planning for a long-term closure, and that we may or may not open before the end of the school year. And so all of those, there are, as you can imagine, there are many more questions than there are answers related to that. And so we are working on those. We are trying to stand up frequently asked question documents and things like that to give parents and give kids. I've gotten emails from kids about what's happening in our school district, and I applaud those students for engaging in the process and being mindful of the impact that this has on our community. So as we talk about closing the door of the physical schoolhouse, let's talk about standing up education in a different way. A week ago, I asked Dan Dukes, our Associate Superintendent of Curriculum and Instruction, where we were with respect to online instruction, and he essentially told me we're nowhere. And while I think we were better than that, we were not prepared. But I will tell you that an army of people has done a significant amount of work in a very short time to prepare to open online on Monday. And so I'm going to take a minute to show you what that's going to look like. And we will be sending information out to parents, but if our media partners can help us get this out, we want to be ready to continue the learning process right now and officially on Monday. And so when you see on the screens in front of you, you see that we have our school website, www.abileneisd.org, is up. And there are any number of places that you can click on online learning. We're just going to give you a quick sample. If Charles, if you'd go ahead and do that for me. So a parent will be directed to this page where they can see the different grade levels. If they're an elementary student, they would click on the elementary tab. We'll have lessons populated over the weekend and on Monday, and so a student will choose their grade level. Again, the structure is built. This is what teachers are populating today and tomorrow across our district. So we've tried to make it as easy as possible for students and their parents to get to the online content. We're going to be releasing the first week of lessons for Monday, and then every Wednesday is our goal to have the next week up. We've been training teachers on the process. You see this as a shell right now, but I just want you to see how it's going to be very easy. And so as they begin to populate the lessons, students will interact there. And this is how we're going to continue academic services. Now, I want to be clear about something. We are
going to make academic content available. And we are encouraging our students and our parents to support them in doing so to access this content. You can imagine that there are all kinds of questions about how's it going to be graded, when is it due, things like that. And the answer is it's not going to be graded. This is the pure purpose of schooling, is the advancement of knowledge. And so it's work at home, but it's not necessarily homework. It's not going to be graded activity. Students do not all have to participate at the same pace. We are just trying to continue the instructional process as we move forward. And so that's just a little look at that. But what has to be necessary for that to occur? Well, the student has to have a device. Okay, and so some students have devices, some students do not. And so parents that are listening, if you do not have an internet-capable device other than your phone at home, we want you to know that it's our goal to provide that device for you. Tomorrow, starting at 7 a.m. and running through 7 p.m. at both Johnston Elementary on the north side of town and Bowie Elementary on the south side of town. So Thursday and Friday, 7 to 7, at Bowie and Johnston, we will be issuing Chromebooks to students. Some guidelines about that. We're going to, right now, as you can imagine, we don't have 17,000 Chromebooks ready to hand out, but we do have about 5,200. And we believe that that will be enough to fill the gap that exists. But especially as we get started, we're going to encourage only one per family. And as students come to pick those up for elementary and middle school students, we are going to require an adult that is listed as a contact for that student at school to be present to sign for that device, and we'll check it out to them. If we have high school kids, as long as they have their school-issued high school ID, they don't have to have a parent or guardian there to check it out for them. And so, again, we will be beginning to pass those out tomorrow morning at 7 a.m. And run through 7 p.m. on Friday night. And then what else has to happen is you have to have a device, but you have to have internet. And so I will say that we have entities and agencies in our community that have been working very hard to make sure that broadband network access is available for anybody that needs it. We have some local vendors that are really stepping to the plate. I would encourage anyone that needs help in this area to call 211. Dr. Ashby may talk a little more about this in a little bit, but for answers to how to get online access at home if you don't currently have it. I will also say that we are trying to think outside the box in the school district about how we can make internet available. I joked on Friday in our press conference, we literally are building this airplane while we're flying it. Really, I should have talked about a school bus, because we are going to have mobile hotspots in our community that we're going to put the mobile device on the bus and be driving the bus to different places in the community and try to provide Wi-Fi access for students on a schedule there. And so we're just, I don't have all the answers now. We're really trying to make this as seamless and user-friendly as possible. As Mr. Light mentioned earlier, please be patient with us as we go forward. We don't have all the answers right now. We're going to continue breakfast and lunch service as was announced Monday. We served about 625 students today, which is about a 20% increase over yesterday, and so we know that those numbers are going to grow. Again, breakfast service is available from 7 a.m. to 9 a.m. Lunch service available from 11 a.m. to 1 p.m. at Martinez, Bowie, and Johnston Elementaries, and each of our 4 middle schools, Craig, Clack, Madison, and Mann. We are working with Texas Department of Agriculture. They were on a webinar even at 1 o'clock to broaden the scope of what we're able to do, to allow families to be able to pick up more than one meal at a time, or they don't have to have the students present with them to get the meal. And so we realize there are some rules currently that might impede as many people eating as possible, and we're doing our best to do away with those barriers. And if we have to, we'll just provide them, and the school district will pay for them. And so that's where we are with the community feeding. One last thing that I want to make sure you're aware of, as we transition to campuses being closed and not as many people available to answer phones and even the doors of this building being locked. We are standing up a new telephone information resource line. Should be easy to remember, 794 AISD. Even this Aggie can remember AISD. And so that's the phone number, 794 AISD. Callers will be able to choose from, is it an academic question? Is it a social services or mental health support question? Is it a technical question about network accounts, things like that? And those will automatically get routed to the correct person. So lastly, I'm sorry I've talked so long, but I had a lot to say today. We want to heed the medical advice that we're getting from the experts in our community. This is a time when we've got to retreat within ourselves and really monitor our activity and obey the expectations in terms of group size. Again, I've said before, this is not the time to travel and be careless with our activities. And so if that changes what families have to do, then I'm completely supportive of that. And as we've demonstrated, they have some online activities that they can do. So thank you for your time today, and I'm going to call on Dr. Kathy Ashby, the Chief Executive Officer of United Way.
Good morning. We're thankful to be a part of the community of Abilene as we take care of each other. After meeting with AISD and community leaders this morning, we've made adjustments to community services to help flatten the curve of the virus. We believe our most critical needs are going to be food and ensuring the food supply and providing child care. Based on the gifts received to Abilene United, we're going to work directly with the Food Bank of West Texas to ensure that their shelves remain stocked and ready to fill the needs of our local food pantries who can thus serve our families. In addition, we have worked with the Alliance for Women and Children, the Boys and Girls Club, and the YMCA to provide child care for children ages 5 to 13 for essential personnel. The beginning list of essential personnel would include healthcare facilities and related industries, community partners who provide essential needs, retailers who are responsible for providing essential needs such as grocery stores and pharmacies, essential county employees such as law enforcement and corrections, and others. There will be an application that will be released on Monday, March 23rd from the websites of the Alliance, the Boys and Girls Club, and the YMCA for these families in essential industries to apply for child care. Child care services are scheduled to begin on Monday, March 30th at Bonham Elementary and Martinez Elementary for children ages 5 to 13. Other sites will be added as qualified staffing is prepared. I heard Dr. Lowry loud and clear. This will not be traditional child care. We are going to follow the CDC guidelines. There'll be small groupings. We'll be eating in our rooms. We'll be playing separately in those small groups so that we continue to take measures to flatten the curve. We do want to encourage anyone who needs help during this time to contact 211, and they can help guide you to food supplies and other basic resources you may need. 211 is still the greatest resource to direct the community to services. Abilene United is still a very important vehicle for us to use it to provide relief funds. Our website, unitedwayabilene.org, or texting Abilene United to 41-444 are ways that you can help us continue to provide these basic needs. We are incredibly proud to watch this community rise to this challenge, and thank you so much for your patience as we are designing and redesigning, it seems sometimes on an hourly basis, services for our community. Thank you.
I know the media will have some questions. I know that Dr. Young and Joey are headed to a conference call, I believe, at 3, and so they can't stay a long time. I know there may be some questions. We talked a lot about team, and I am so proud of this community. Our public CEOs, Mike Murphy, Abilene Regional, Brad at Hendrick, our city manager, our superintendents, Katie Alfred at the Community Foundation, Kathy Ashby, United Way. Those CEOs and their staff have worked 14 and 16-hour days getting us ready, building that plane in midair. So proud of that effort and what that means to our community. I did make an omission. Stan Lambert has been such a champion and really part of giving us guidance from the state level. I want to be sure that he is recognized for those efforts. Stan Stamridge reminded me of something, that business goes on. Last night we had 2 officers that were assaulted and sustained significant injuries. In the midst of that, they had to use deadly force. And so I want to be mindful of those officers and their family, as well as the family of the citizen that had to be addressed last night. This is a great community, but it's only great because of the leadership that exists. And with that, I'll make way and allow you to ask some questions. First of all, to superintendents who will be departing in just a bit if clarification needs to be given. Are there any questions?
I have a question just about graduating seniors, how y'all are planning on taking that on, offering diplomas hopefully by the end of the year.
So maybe Mayor Williams should have introduced this section as the part where you guys ask questions we don't know the answer to. And I get asked that question at home. I'm the parent of a senior in high school. And so I will tell you that the state, and we are going to talk with the commissioner again today at 3 as we do every day, flexibility is the name of the game. And whether it be testing requirements or credit requirements, they're going to allow us to locally make those decisions and err on the side of kids as we do so. And so we've got to make sure at some point at graduation, whether graduation is May 23rd at the Expo Center or whether it is in July, I'm going to need to stand up and Joey will need to stand up and certify the graduates. And so we're going to have to make local decisions to make sure we can do that in good conscience, but I believe we'll be able to do that. Anything you want to add?
And I would just echo what he said. This is a time where we really need to embrace this group of seniors. They are going through a hard time, not just graduation, but many of them have been involved in activities their whole lives, and then all of a sudden, due to this crazy virus, the rug is ripped from underneath them. So we are definitely in a time where we are going to try to do everything we can to ensure some normalcy and wrap them in love as well. So we're going to make it through this.
I just tell mine to call Joey Light.
Yeah.
So the online requirements, I know that y'all were talking about how, there might not be a grading system. Will that be different for seniors?
Well, and so you're asking some questions that kind of get into the weeds. Right now, what we're doing, and I think I probably missed this, but when we are also starting on Monday with our delivery of home learning. So our desire is, again, to get from here to there. And so for seniors, there's a whole lot of things going in the mix. There's GPA issues, there's scholarship issues, there's a lot of things. And in that learning situation, there's also some integrity issues that are difficult to monitor. So at this time, we are not looking at grading. We do have a lot of questions that we are going to sit down and continue to work through with our administrative staff. But right now, you got to remember, it wasn't very long ago we weren't even necessarily shutting school down, and now we just continually add on to some issues for our high school staff and our administrations and school boards to consider.
What about, fantastic, obviously, that you're passing out those Chromebooks, probably for those parents, sad to say, who maybe can't afford them for their children. Internet access, parents that don't have it, are they to call 211 and just try to get it, but will they have to pay for that?
So the reason we're directing those calls to 211, John, is because they're I'm aware of one provider that's willing to provide at least 60 days of free internet access for parents, but they may not be the only one, and so I didn't want to give a list. I know that 211 is able to assimilate all those connections for folks. So we believe that there will be entities that are providing it for free to folks. Also, that's why we're going to try to do the neighborhood roving hotspot bus as well, because we want to ensure that we give everyone the opportunity to participate.
And you may have addressed this, Dr. Young, at the last meeting. Teachers will be paid through the end of the year?
Correct. Teachers are what we call exempt employees, and so that's your teachers, counselors, but our board at our meeting on Monday night did adopt a resolution to address our hourly employees, the non-exempt employees, so that of all the things people have to worry about during this time, that's one thing that's at least taken off the table. Any other school questions for us? All right, great. Do y'all have questions for the city folks? Yes, that's what I thought. Okay.
Health officials in the city, if they're available.
Yes, sir.
Hi, Mayor. Mr. Hanna, hi. We've been meeting a lot like this lately, have we not?
That's accurate.
So that will be effective Monday, the 50 or more gatherings.
Sunday at 8 p.m.
Sunday at 8 p.m. Okay, just to clarify. If there is a case, as is what happened in Lubbock yesterday, that city guaranteed their residents that they would notify them in a very short amount of time if there was indeed a confirmed case, and they did. I think that it was 5:30 or 5 o'clock, they identified the case, and by 7:30 they had a press conference. Will that be the same here in Abilene? Will you pledge to notify people immediately once you get a confirmed case?
I think what we've said from the very beginning, when we have a confirmed case, you will know it. I think that we've tried to be very aggressive and be sure we disseminate information that the public want to know. Part of the reason why we've met so often in the last few days is fulfilling that expectation. Yes, sir.
Is it okay to pay utility bills late?
Let Robert speak to that.
Encourage everybody to pay the utility bill on time. If you're going to have difficulty paying, you can contact the utility office and try to work out payment terms. But we are a public utility. We provide water service. There's a cost of that, and we're going to have to try to recoup those costs as well. I will say that during this extraordinary time, we're prepared to do extraordinary things to help our customers. Now, let me just address Mr. Ruppolo's question, too, a little more directly. We're not hiding the ball on anything, and as soon as we know, we'll notify the public in as fast of a time as we possibly can.
Well, I wasn't suggesting that.
I know you were. I'm just wanting to give a very definitive answer that we are keenly aware of our role to communicate public health concerns, and we're going to make sure we do that with honor and integrity.
And moreover, we know about the anxiety. I mean, I have anxiety. What we really tried to do, and I hope you've noticed this, I mean, we have been working around the clock trying to be sure that we put the best foot forward. And so we're going to be transparent, we're going to provide an education, and we're going to continue to serve this community and do so in an excellent way. Any more questions before we go back to work? Yes?
I do have one more. Related back to utility payments and stuff, we had a Facebook question from our Facebook Live.
Sure.
What about people that don't have credit cards that can't pay online?
Yeah, it's a great question. So there's a drop box, like a payment drop box at the actual customer service office right next to the police department. There's also one at City Hall on 5th Street. And so if you happen to have, you don't have a credit card, don't have a debit card, and you have to do cash or check, you can certainly put that in an envelope, put that with your return receipt from your utility bill, and drop it in the drop box. It's a great question.
I have one last question about elections. I know the governor was talking about today, allowing cities to postpone those in May. Is that something that we're thinking about doing?
At this point in time, the city's not considering postponing the election. We anticipate having council elections in May as regularly scheduled.
I have a question. This might be more for Mayor Williams. If you found it necessary, would you ask that local businesses keep their doors closed too?
we will do whatever we think is required in that moment to protect and serve this city.
That has been a question that has been emailed into our newsroom, Mr. Mayor, Mr. City Manager, about businesses, restaurants, gyms. Will you order them to close if need be? Do you have that authority to do that?
Well, again, I want to say this. If we see a need to react in a way that will protect this community, we will do that in regards to confines of the law allows us to do. We've been very, very sensitive to business. That's why initially we talked about the 250 limit, and we said we would hold firm unless we got other information that encouraged us to lower that. I've talked to the middle community, we have lowered that. And one thing we have not said today, because we're not ready to communicate it, there are some other things that we're discussing, talking about to help our small business. We are aware that 70% of all jobs in this community are service-oriented. When a restaurant reduces their hours by 25%, then that man or woman just took a 25% pay cut. So we're sensitive to that, and so we've talked with SBA even this morning. That's Calvin Davis, offices in Lubbock. Doug Peters is not here right now because he's been convening with a small group that's putting together a plan to address that. I could go on and tell you how many groups have been working around the clock, but just know this, as a team, we're doing everything we can to serve this community.
I know some people have already lost their jobs. What can those people do to find another job? Are there resources? Does the city plan to do anything?
There are resources, and I will help. I'll let the mayor address that, but I want to follow up to the original question that Mr. Rupo asked about closures and those sorts of things. Rapolo, excuse me. Asked about. I should totally know that by now. So this order that the mayor has done today accomplishes exactly what you've asked. Gyms, restaurants, business venues, public gathering places, stadiums, indoor stadiums, outdoor stadiums. If you have over 50 people in there, you're in violation, okay? And those 50 people include your staff as well. So this is going to have an impact. We don't do that without sober thought and the concept that we are trying to avert a larger health concern. And we ask and need the private sector's cooperation on this. I do not have, nor does Chief Standridge have enough police officers to go knock on every business door and count the number of people in there. If we're going to get through this, we're going to get through it as a community, and we're going to have to come together and follow the prudent advice that has been given by our federal government, the CDC, and the mayor's decree. Mayor?
And so there are mechanisms. I didn't have a chance to talk to Mayor Ross on today, but certainly there are opportunities out there, and we want to be able to provide an opportunity for workforce solutions and other ways that will help that family in need. And certainly there will be families in need. I want to get into it right now because we're not ready to, but I made a couple of asks to some private entities today that we think could fill a gap short term and be able to address some of our community's most vulnerable. Any more questions before we go back to work?
Can we talk to Henrik? Possibly?
Mr. Holland, you want to come up for Brad? And Brad Holland, and again, I want to publicly thank both our hospitals. Brad gave us precious time on this morning and brought together a number of healthcare professionals and allowed us to really be educated today. They helped lead and guide this decision, so thank you, Brad. And by the way, ask him to demonstrate his new Hendrick hello, too. That's a different conversation. So.
Hi, Mr. Holland. Just to follow up with you, I know that we talked on, was it Thursday that we talked last? What is the status of patients at the hospital that may have this virus? Are there any right now that are in quarantine in a hospital setting at your facility? How many are being tested every day? Are those tests being sent out, or do you have test kits at the hospital to deal with that? Is your ER being overwhelmed with people coming in and say, hey, you know, I'm sneezing, I'm flu-like, can you test me? Can you help me with those?
Was that one question, or was that? Let me just make a couple statements. How's that?
I guess first thing I want to ask you is there people right now that are at the hospital that could possibly have this virus, and they are waiting for tests to come back to confirm it? Let's start with that one, if we may.
Yeah, great question. So first of all, I'd like to thank Dr. Lowry, who is a Hendrick Chief of Staff, that has been instrumental in working with the Hendrick and the Hendrick administration, the Board of Trustees, and our employees to really put Hendrick in the best prepared manner to meet the needs of the community. And again, I can't stress enough support for the leadership of this city and the school district, and recognize that the sacrifices this entire community is going through is people making an active sacrifice in their lives to save lives of others, because that's what we're doing. We're saving the lives of others through this social distancing effort and increased hand washing, and that's what people can do. Just like we've seen a lot of people go out and take control of their lives buying toilet paper, they're saving lives by taking control of their own actions. In addition to that, the social distancing, but it's to support also the healthcare industry and the healthcare resources. And that is not lost on every single healthcare provider, because it is a sacrifice that every one of you is going through. And we take that very seriously. To a couple of your questions, this is something that the Hendrick leadership and physicians have been watching for months. This isn't anything that happened in the last couple weeks to Hendrick. We've put together a COVID task force made up of medical members, has a medical task force. We've got a COVID task force of the hospital membership. We are working on a daily basis as well to protect not only our employees, but also the community. I would say that we've got about 8 subcategories of activities that we're working on. Kind of the organization and preparedness of the organization, preparation and education of ourselves, staff, and community, access restrictions into and around the buildings, screening and testing of our employees as well as community members, resource allocation and a labor pool that may include people doing different jobs as volume ebbs and flows in and out of different services, because it is not business as usual. Supplies, that includes things that we work on a daily basis, but also protective personal equipment and personal protective equipment conservation efforts that we hear. In addition to that, physician engagement. We're only as good as the physicians that we surround ourselves with in the medical community, as well as communication in general. And again, that's a part of me being here and Dr. Lowry working on behalf of that. We have a very good working relationship with the city, as well as our public health officials. We are working with the public health officials, and we too have been committed to, if we have a COVID positive patient in the hospital, we will communicate that openly and transparently. We have tested people that have come to the hospital through very strict criteria that meet CDC testing guidelines, and because there are not enough test kits to test everyone in this community, we have to use that precious resource to test the most critically ill that meet the CDC guideline testing rules. And so one of the things that I've had to educate myself on is, what does the testing kits mean? Testing kits, there's not anything that a hospital will get. We don't anticipate ever getting a testing kit. What we receive at the hospital are what we call testing mediums, or swab kits, or swab bags. We try not to call them kits because it gets confusing. These swabbing bags that you put up your nose, that's one thing. The testing kits that we hear about are what third-party labs, LabCorp, Quest, or ARIP use in a remote location to test the swab. So we have very limited resources of swabbing bags and medium, and there are very few testing kits. So you have, at the local level, few of both precious resource. So we have to use those resources to test the most critically ill.
So do you have, Mr. Holland, hospitalized with extreme flu or whatever that are awaiting tests to come back to see if they have the virus?
Yeah, great question. I know that we have tested people, and as far as waiting on the response, I believe that we do, but I cannot confirm that because I know that we have had some come and go.
Okay. Do you know
But
how many are there now?
I think a handful of people that have been tested and that have come back as all negative.
So you're
Again,
you're actively doing this.
actively,
Actively doing it.
actively.
And you screen them first with questions, right?
Yes.
Whether or not they've been overseas, whether or not they've had contact
Yes.
with another person, whether or not they've traveled to those 4 or 5 bad
Yes.
areas, quote unquote,
Yes.
CDC guidelines in the state. And if they meet those requirements, they are tested.
No. We will ask them, as an example, I went to an annual medical examination yesterday. Not urgent, but I was screened with the 3 CDC questions. And because I was able to answer those in the negative, I was able to proceed with my normal healthcare examination. If at the point in time it was determined that I met screening criteria, I would be determined to go visit with my primary care physician. And in consultation with my primary care physician, they would determine the best course of action for me to be treated. Because I may not be critically ill, like I needed to go to the emergency room because I was crashing, but that was a decision that I would make with my primary care physician.
And that's what you're recommending to the public.
Absolutely.
You go to the primary care, your primary care doctor, or even the city health services.
Correct. I'm looking around at a lot of what we call walkie-talkie healthy people in this room. There is no reason you would ever just all of a sudden show up to your primary care doctor's office right now or to the ER right now. We would encourage everybody to call your primary care office before going there in person during this extraordinary time.
Thank you.
Thank you.
And thank you. And again, if anything changes, we will provide an opportunity to provide the appropriate update. Thank you very much. And I just thank again Team Abilene for all the work that's been put in during this whole situation. I think Abilene is an example of how community can work together for the good of its citizens. Thank you very much.